You love it when a hygienist has got the treatment's already teed up, and all you have to do is come in and give it the blessing, right? That's what we do at Inspired Hygiene, and we love doing that. And we focus on doing that in a way that inspires positive change for everyone.
Hello, everybody, and welcome to another episode of the Raving Patients Podcast, sponsored by Cloud Dentistry and the Doc Sites. As you know, I'm your host, Dr. Len Tao, and I'm really excited today to have someone I've been asking for a very long time to be on the podcast. I think she told me this is her second one, so she's done one before me. But when I first had approached her about it, she hadn't done one yet. And I said, let's do one together. We're finally catching up. I met her at SCN a number of years ago. We've kept in touch. She's a bubbly personality. She is Emme Sanders, RDH from Inspired Hygiene. Today, we're going to be talking about elevating communication to change patients' behavior. And some of the topics we'll be discussing are something called the communication rule 73855, which I know a ton about because I teach it myself. So I'm really excited to delve into that a little deeper with her. Applying transformational language in daily patients' care and discovering your professional communication power. So please welcome to the Raving Patients Podcast, Emme Sanders. Emme, thank you so much for joining me today.
Thank you for having me. I'm so excited, a little bit nervous too. I mean, it is you.
Well, there's nothing to be nervous about. I'll walk you through this. I'll help you through the process of getting your message out to my audience. So, but thank you so much for joining me today. I really appreciate it.
Yeah, I love what we get the opportunity to do. I've been a hygienist since '93, and have accidentally stumbled into coaching when a patient asked me, who was a dentist. He was like, I've never had an experience like your hygiene appointment experience. Would you be willing to share this with my hygiene team? And so I accidentally got into coaching dental teams, and I love that. And joined up with the fantastic Rachel Wall. I know everybody knows Rachel Wall. She's marvelous at Inspired Hygiene. And well, we've had a wonderful time really growing and cultivating the Inspired Hygiene team. And now I'm speaking and really traveling a whole lot more. So life is good post-COVID.
Well, that's good. That's good. I had your colleague, former colleague, I think, from Inspired Hygiene, Jamie Marbo, was a guest of mine in the past. So I think she left Inspired Hygiene, didn't she? And she's on her own now. Is that correct?
Yeah, she is. She is on her own. I think she's killing it. So that's great.
That's really good. So I mean, let's get into some of the content. And as I mentioned on the intro, I am very familiar with the communication rule, the 73855. It was basically founded by a guy named Albert Mehrabian, who was a psychologist. He's a famous psychology professor, and he studied these types of communication that how do people express themselves. And what he really found was that 55% is visual, which is the body language, the facial expressions. He found that 38% is vocal, the intonation or of how something is said, and 7% is verbal, and are the words that are spoken. And I teach a workshop called The Art of the Sale, which is now on demand for those who are interested. And this is a big topic of what I talk about, because our words make up a mere 7% of the message that we're trying to convey to the patient. But countless people agree with him that 93% of the communication is based on your body languages and how you say something to them. So yet most dentists plan out what they're going to say and don't give much thought to the nonverbal communication. So I'm a very big believer in this in the way of these simple body language skills. So why don't you kind of take the listeners and the viewers, because it's on YouTube and will be as an audio podcast as well. So why don't you take them on a little bit journey through your ideas on how this whole process works?
Okay, I would love to. And being a hygienist, so you know, I'm going to speak from what I'm good at, right, is serving the patients. So how I use my Mehrabian's rule is, yeah, we can focus on the 7% of the words and getting all the right words out. But if I really wanted to take it to the whole next level, I needed to dive into that 93%. And what I love is I really play the nonverbal game. I use that strength to my advantage. Now, you can use the 38% is the tone and the volume, like inflection in your voice. I use a lot of that to my advantage, but I really use a lot of verbal skills, nonverbal. So it's like my husband says, if I tied your hands behind your back, I don't think you could speak. Well, that's true, because speaking to patients, I want them to really be able to know and understand, and we know that visually, if they can see it, they're more apt to remember it. Remember that phrase, a picture's worth 1,000 words? Well, what I'm trying to do is really get into that visual part of their brain so that they're tracking with me and able to finish that. So I want to share with you something we do at Inspired Hygiene. It's called the 3 Ps of periodontal enrollment. So I'm just going to jump through that really, really quickly. It's the prep, probe, and present. And so I'm going to use that as a great way to share with you how I use body language to do the prep, probe, and present of periodontal enrollment. So like prep is when we, the healthcare provider, are preparing our patients for what we're about to do for a periodontal assessment. And I'm just going to give you my little canned version. You can see I've done this 1,000 times, so I'm kind of getting good at it. I would turn to the patient and I would say, Lynn, today I'm going to evaluate your gum tissue health. I'm going to tell you if you have healthy gums, gingivitis, or periodontal disease, because you're going to fall into one of these 3 categories. I'm going to call out some numbers, 3 and 2. Those are all really healthy numbers that you're going to want to hear. And I'm even going to call out 4s and 5s. And if you have a 14, I'll call that out also. And here's the thing. We'll talk about all those other numbers at the end. But what I want you to know, Lynn, is healthy gums don't bleed. So that's kind of my canned phrase that I say to my patients to tell them I'm about to do a periodontal assessment. Let's break that apart. So I told them I'm going to healthy gums, gingivitis, or periodontal disease. And what I did was I used my fingers to identify those 3 things. So there's the visual aid for that. And then you're going to fall into one of these 3 categories. So I use this other hand to simulate falling into one of these 3 categories. And when I said I'm going to call out some healthy numbers, notice how I'm doing the head bob, because that's in the positive affirmation. 3s and 2s, those are all healthy numbers you're going to want to hear. And if you have a 4, a 5, or even a 14, so see how I map that out as a linear, a long period. Here's a 4, here's a 5, and here's a 14. Well, if you have all that, we'll talk about all that at the end. And then here's my favorite secret. Pause right before you're going to deliver the most important line. The reason why we need to do that is because the human brain is just like rapid fire. And if I can pause, it's almost awkward, right? Pause, and then I say, and Lynn, healthy gums don't bleed. What I'm doing with that pause, I'm using that to my advantage so that your brain has the ability to catch up and hear the next most important phrase of the sentence. So that's what I use for the 3 Ps of periodontal enrollment. That's just the prep part, but you can get the point how you can utilize body language and eye to eye. You really got to look at patients in the eye. And here's another fun thing. Let's say you're going over a treatment plan. Let's pretend like this is a treatment plan. If I'm going over a treatment plan with a patient, it's really cool for me to sit side by side with the patient and have the treatment plan in front of us, because the subliminal messaging here is that the 2 of us are going to fight against this together, right? Whereas if I'm going over a patient's medical history, I'm going to want to be eye to eye, knee to knee with them to have that conversation regarding their medical history or what maybe prep, what I'm about to do, tell them about what I'm about to do, and then use the side by side to your advantage when you're delivering treatment plans or something like that. I'm sure that's exactly how you do it.
Yeah, well, I also love it because I love using, and one of the things I noticed you were doing, and I don't know if it's just you're really excited, but you're nodding your head a lot, and that nodding means more than just yes. So I teach these different types of nods, and if you don't mind, I'll describe them here to you so people can understand this. So one of them is like the single nod, so that's like this, and we nod, okay, but the single nod reassures the patient that you're listening to them. When I show that I listen because I nod my head, okay, shows them understanding what they're saying. So an occasional nod when the patient is speaking will affirm that you're listening and keeping up with what they're saying. The second thing is the multiple nods. Okay, not a bobblehead nod, but a multiple nod, and this shows that you understand what the patient is saying, and you want to nod continue. You don't want to nod continuously because that doesn't look good, but you want to be aware that when they make a big point that you understand what they're saying by doing multiple head nods. Now, I call this the OIC nod. Ready? Nice, slow head nod.
Oh, love that.
This verifies that, or recognizes that it's something important that was said. And then I don't know if you know about the imperceptible suggested nod. So here's an example. Let's say a patient needs scaling and root planing, okay? And you say to them, well, Dr. Tao, I know that you are going to, if I prove to you that you're going to need to get scaling root plan, you're going to go ahead and proceed with treatment. So your head is nodding. It's called the suggestive nod. So correct. You're going to so just like doing this, you're going to proceed with scaling root planning if I prove that you need it, correct? So that's called the suggestive head nod. It's all imperceptible, but it tricks their brain. I do it when I want people to accept treatment and accept third-party financing. So if I can get you money through third-party financing, you're going to go ahead and go through a treatment, correct? So it's called that suggestive head nod as well. So those are all things. So I think we have head nods, we have the eye contact, and then we have smiles. Those are the three things that work really well in our advantage for this nonverbal that we're talking about. And we're dentists after all, so we love to smile. Unfortunately, when we were masked up, it prevented us from really smiling well. But I think not everybody's always masked up anymore because COVID is kind of not where it used to be in the dental office. But that's really what it comes down to. The art of eye contact, nodding, and smiling will really help you with this nonverbal stuff.
And I want to add to that list the pause.
The pause, yes, the pause. Which is the pause. I don't pause well because I'm always mentioning to the patient. I'm always excited to discuss things. But yes, I think pausing is really good as well because you can do it for inflection purposes. You can do it to explain something and then pause it to really make sure they understood what you said. And really also it is to let them say something if they want to say something back. So if you pause and they want to comment, you give them a chance to comment. You're just not talking over them as well.
That's right.
That's great. So anything else that you think is important? Because I love this communication style. Like I said, I've been studying it for years. So is there anything else you want to make a point of when it comes to whether you're a hygienist or even from a dental perspective when it comes to this 730-855 rule?
Not specifically to the rule, but one of the things that I love to coach our teams is about, it's important to know what to say, but it's almost more important to know what not to say.
100%.
Right? Of course, the 7% is the words that we use, right? So we want to focus a little bit on the words. And when I say a little bit, there's the key. Take little right out of your language. We should never use little, right? Because it's like being pregnant. You're either pregnant or you're not.
There's nothing in between.
There's not an in between. You either are or you aren't. You either have a little bleeding or you have bleeding. It's just, right? You're not a little bleeding. It's bleeding. So it's important to get clear with your teams on the words that we don't want to say. And the words that we do want to say, we want to use words that are going to really be a positive reflection on who we are as a practice and what our philosophy is, how we serve our patients. So, yeah, there's lots of good stuff.
Well, it's funny. You talk about being pregnant, not being pregnant. You're either pregnant or not. Well, I always talk about how when I work with offices, I need them to make a commitment. And to make a commitment in this case to like marketing your practice. And I always say, it's either in or you're out. There's no such thing as life in between. So, I mean, it's the same type of thing. So I get what you're saying completely there. So, I know you use a term called transformational language, and how it's used in daily patient care. So can you talk or touch base on what transformational language is and how you apply it in your daily care of patients?
Yes. So as a practicing hygienist, I can call myself a hygienist, right? Or I can move myself into a healthcare provider position, right? So I'm almost up leveling my language, transforming what we call ourselves. Therefore, we're elevating what the community sees of us. There's some other great things that you can do is really to transform your language is we've dumbed down dentistry a lot in the past to make it more palatable for patients. But I think it's time that we really crank it up, and it's okay for us to talk about inflammatory burden, inflammatory cascade, and to really use the full names of bad bacteria that are causing active infections. And sometimes we don't say active infection. And if we want to really get to our patients so that they can clearly understand where they are in health or in disease, right? We've got to transform our language, and we've got to say bleeding. We've got to say it with more conviction and heart, and really get our message crystal clear in our mind so that we can transform the words that are going to be more acceptable and patients really get what we're telling them. Because I have found that the better that I can communicate to a patient, the higher my case acceptance rate is. That's just the side effect. If I can tell the patient, get them to understand it and believe it and know that I'm coming from a place of love and want to serve them to help them have the healthiest oral health possible, they're going to say yes to treatment, because here's what all of us, all humans, all of us want to be healthy.
We do. I'm curious, and I want to ask you your thought on how you broach certain topics with patients, and or how you would do it from a periodontal perspective, in the sense that we always want to dumb things down, like you said. I love using the terms that they understand, like periodontal disease. They don't know what that is. They know the word disease, okay, but you have a gum infection in your mouth. When I talk about an infection, what do I talk about it? Well, you have pus. Patients understand infection and pus. And when they hear those things, they want them out of their body. Okay. So to me, that's a very powerful word to use. You don't call it a periapical infection. They don't know what that means, the patient. You say, I say a pus pocket in their bone, and then they go, pus in my bone, I got to get that out. So that's how I've gotten them to take action for those things. So I like to spread a sense of urgency without being over the top. Do you agree with that? Do you disagree with that? What are some words that you use in the hygiene chair? Because we want to dumb things down, but we don't want to scare the patient, but yet we don't want to make it seem like it's not a big deal.
Yeah. So some of my favorite words are therapy. You need gingival therapy or periodontal therapy, not scaling and root.
Yeah, they don't know what that means.
I definitely love the word pus. It beats exudate all day long. So I use pus. I use bleeding. Most people know that bleeding is not a good thing. I also use active infection. That takes infection to a different level, right? So I can say gingivitis, you have gingivitis, but they talk about that on Listerine commercials, right?
Yep.
So what I want to tell them is, you have an active infection, means it's actively happening right now. And here's what I know, that people who have this active infection have an elevated risk of cardiovascular events and stroke and diabetes, Alzheimer's. So it's in your best interest that we treat this active infection with periodontal therapy. Tell me what questions you have for me now, right? So once you lay all that out, who wants heart disease and stroke and diabetes and Alzheimer's? And you got to link all those together because they're associated. I was just reading another article this morning about fusonucleatum and Alzheimer's risk. So yeah,
You had used a term earlier that you don't want to only be a hygienist or a tooth cleaner, that you want to be the patient's healthcare provider, I think you had used, or practitioner. I like, and I've taught a lot of this stuff over the years. I like to be a physician of the mouth rather than just a dentist. So I like, because we're treating systemic stuff, not just the mouth. But I mean, I don't think people understand that as much, or don't respect that as much. So I appreciate the fact that you said that you want to be more than just someone who cleans teeth all day long. And I think if you go to that extent and elevate what you do, it changes your outlook on your career. And I don't mean this negatively to any hygienist out there, but if you just want to be a tooth cleaner and just clean teeth all day long, it's a very different way to look at things than looking at the outlook that you have. And that's why you're in the position of coaching people, because you have that outlook.
Well, thank you for saying that. That's really sweet. And I want to quote Dr. Bradley Bale. He's a cardiologist. I don't know if you guys know him, Beat the Heart Attack Gene. But it's his quote. He says that 50%, it's a landmark study. It's been proven that 50% of acute cardiovascular events are triggered by an oral infection. Now, stop and think that through. Who is the oral healthcare expert? That's us. 50% of acute cardiovascular events are triggered by an oral infection. That's a lot. And we have great opportunity to really serve our patients at that healthcare professional level.
We do. So the last thing I want to talk about before we have some fun and do the Q&A and stuff is you wanted to discuss discovery. How do you discover your professional communication power? So how do you take someone to the next level when it comes to communicating with their patients?
Well, the very first thing you've got to do is have the philosophy that you believe it. So you've got to do all your research, because here's the deal. I've had dentists come to me and say, okay, we're going to offer this product. I need you to sell it to a patient, right? Well, that's never going to work. What will work is when a person believes in something, they're going to change the way they talk about it, act on it, and how they share it with their patients. So the very first thing to really discovering your power is discover your philosophy. And if you're already in with a really stellar team, it is a wonderful opportunity to have a team meeting around philosophy. Why is it that your doctor recommends this service at this point in the tooth's life? Why is it that you want to diagnose periodontal disease at its earliest opportunity? Why is it? What is your philosophy? Once you know your philosophy and you believe in your philosophy, that's really going to help you transform how you speak to your patients.
Gotcha. So that makes a lot of sense. So is there anything else other than your contact information, which we'll get after we do the pod deck section? Is there anything else that you wanted to make sure that you got out? Any messages you want to make sure the listeners or viewers hear regarding you, inspiring hygiene or anything of that nature?
Absolutely. I want to just tell you about our group at Inspired Hygiene. We are all hygienists and we love what we do, and we are all driven to be healthcare providers for our industry. And we are honored that we have the opportunity to work with amazing dentists and their teams. And if that sounds like something you want to do, whether it's getting everybody aligned on exactly what periodontal disease is or why you do co-diagnosis, because doctor, you love it when a hygienist has got the treatment's already teed up and all you have to do is come in and give it the blessing, right? That's what we do at Inspired Hygiene, and we love doing that. And we focus on doing that in a way that inspires positive change for everyone. If that sounds like something you're interested in, you can find us at inspiredhygiene.com. I also have my own website page, which is Emme Sanders, RDH.com. Either way, you can get to us. We also do hygiene analysis, or we call it our roadmap. It tells where your hygiene department is and where the potential is for you to go. And if that's something you're interested in, you can find that on inspiredhygiene.com. And if you want, I'll shoot that out, a quick link in this. And put in Emme 300 and you'll get $300 off that, just because you all love Dr. Towel like I do.
Well, that's perfect. So I want to go over this section for those that have listened to the podcast before. It's a lightning round Q&A. We're going to pick a deck called The Hustle, which is all about like business and things that help you run your business and stuff. So the goal of this, for those that don't know, and you haven't done this before, Emme, I'm going to ask you a question, very, very fast, lightning round answers. You don't have to go into long, drawn out answers here. We're going to try to get 7-8 questions done, and then we'll wrap the podcast up. So, first question, what profession do you think is the most undervalued today? I knew you were going to say that. Perfect answer. Well, what do you think your unique skill is that has helped you become successful?
Communication.
What skill do you feel has made you successful?
What skill has made me successful? Well, I believe that if you want to be successful, you got to hang out with successful people. Okay.
So what is the one person you'd love to have as a mentor?
Oh, gosh, that's a toughie. You.
Me? You want me as a mentor?
Yeah, you.
Okay.
I can learn so much from you.
I'm glad. What deserves all of your attention but seldom gets it?
My health.
Okay. Here's an interesting one. What kind of shower ideas do you get? In quotes, shower ideas.
Oh, for those of you who know me, you know I practice all my verbal skills in the shower. So once I get my message really clear what I'm trying to say, I will say it 1,000 different ways in the shower. It might take me a week to really get one phrase or statement down perfect.
So I have a question on a separate note. So you were in the Spotlight on Speaking contest at SCN a few years back. Did you practice in the shower?
Yes.
Okay. What key activities would you recommend hygienists invest in for their time?
I would say learning, reading. Here's what I do know. The learning never ends. Our dentistry is changing weekly. So buckle up, Buttercup, because there's a whole lot more out there that we still don't know yet.
Do you have a system in place to keep yourself organized?
Yes.
Do you want to describe it?
Yes. I don't know if you know about 3M Post-it notes. I've got a really big one over here and a whole big wall over here, and I keep 3M Post-it notes going all the time.
Okay. What has been your most satisfying moment in dentistry?
I've had a couple, and I would say they were speaking engagements, being asked to speak at Chicago Midwinter and the Hinman.
I agree with that. I've spoken at both of those meetings. That means you hit the big time if you do that. So,
I've got Chicago coming up in February. I'm so excited.
What distracts you the most every day?
Probably my attention deficit. I sometimes have a hard time finishing making the coffee, right? So I'm constantly distracted by my own mind.
And that's sometimes a good thing. Nothing wrong with that. So, and last question, I think this is a good one. If you had a magic stick, what are 3 things you would change in the world?
I would change our body's ability to heal. It would make it for better. I would also change how we treat every other person. And I would also change, I'm going to leave it at those 2 because those are pretty doggone big.
That's perfect. Those are great answers. Thank you so much for taking part in that Q&A. It's a little bit different from the podcast, but it's fun for listeners. I have a fun doing it. I hope you enjoyed it as well. Sammy, I know you already gave your information on how to contact you. Can you repeat that one more time? So guys, if you want to learn more about what Emme or Inspired Hygiene can do for your dental office, what's the best way, Emme, again?
So we're at inspiredhygiene.com. You can reach me personally at emmesandersrdh.com. Either one, you can find us in coaching or speaking on both of those websites.
Perfect. Well, Emme, thank you so much for sharing your passion, sharing your what has inspired you, and how you've kind of elevated your game in the dental space to those who are listening and watching. So thank you again for joining me today. Guys, if you want to learn more about what Inspired Hygiene can do, please reach out to Emme and her team. They have a wonderful team led by the infamous, or the very famous Rachel Wall, who's terrific. And I know her for a long time. So reach out if you want help with your hygiene in your dental practice. I hope you enjoyed this episode. If you did, the first thing I want you to do is go ahead and go to the iTunes store, subscribe. If you haven't subscribed already, review us. Reviewing us is really important. As the reviews doctor, it's something I really want more people to do. So take a couple minutes, write a review on the iTunes store, share it with your colleagues, let them know you enjoy this episode, and so more people follow us. If you want to learn more about anything I do, drlentau.com, drlentau.com, and check out our sponsors again, the Doc Sites and Cloud Dentistry. And this was great. Emme, thank you so much for joining me, and we'll speak with everybody soon.